Well, I'll just take a moment to get us started and introduce everybody. So, I'm Dr. Paul Despres. I'm here with my wife, Dr. Mele.
Hi.
We also have Dr. Jamie Flanery on the video as well.
Hi.
So, it's going to be a panel of us three going through our approaches to cardiovascular wellness. So, this will include signs, symptoms, risk factors for cardiovascular disease events, our favorite lab testing that we like to do, in addition to frequent treatment we do for a variety of cardiovascular disease conditions. All right, so a little bit about us before we jump into the topic. I primarily specialize in chronic disease, but also do primary care, acute management. I specialize in deep tissue laser therapy, which is helpful for pain management and joint restoration, also ozone therapy and IV therapy. Dr. Mele and Dr. Flanery both do a lot of women's health. Dr. Mele is doing more pediatrics than Dr. Flanery. However, Dr. Flanery does a lot of skin conditions, mental health, gastrointestinal disorders, and also acupuncture. Dr. Mele specializes in autoimmune disease, visceral manipulation, craniosacral therapy, and hypermobility spectrum disorders. So we work together. We are a cohesive team, and we frequently collaborate on patient care just to make sure you guys get all the right support that you need. All right, so I'm going to switch over to Dr. Mele, and she's going to go over her part.
Hi, everybody, and welcome. So I'm going to kind of talk you through the first piece here. We're going to talk about a little bit of anatomy and physiology as it relates to cardiovascular concerns. And we're also going to talk about cardiovascular risk factors. So the first thing we have here is what's called Life's Essential 8. And these are the 8 determined risk factors from the American Heart Association. So, this isn't just information that we're pulling from our own experience, but this is nationally recognized information to help with cardiovascular disease prevention. So going through, you can see some things on here that you maybe already are incorporating or are maybe part of your picture and why you're struggling with cardiovascular disease. But in terms of how these things are affected by the heart itself, we'll first start with exercise. So basically, this is helpful for cardiovascular, and how it intercedes is that it is a good stress on the cardiovascular system. So when we're exercising, we're increasing our heart rate, we're increasing our respiratory rate, and we have that little bit of a rise in blood pressure. That is a good stress on the body. That's healthy for maintaining good oxygenation of our tissues, and helping that body to get a bit of good, healthy stress. In terms of blood sugar, we think more about elevated blood sugar, things like diabetes, pre-diabetes. We're mostly talking about type 2 diabetes and not type 1, which is autoimmune. If we have excess blood sugar in the system, the blood vessels, arteries, and veins, they really don't like that. It makes them inflamed. So that's when we start to see progression of either cardiovascular concerns or other types of vascular issues. So vasculitis, which is inflammation of either small or large vessels. We can see things like retinopathy and diabetes, where the blood vessels behind the eyes start to dilate or they start to regenerate. So in terms of how this relates, elevated blood sugar in the system, we get inflammation in the body. The vessels don't like that. So when we talk about cholesterol, we're talking about lipids and fats that are in the blood. Some of this is related to diet, and some of this is related to genetics. So when we think about cholesterol, we're thinking about hard plaque versus soft plaque. And so that is going to be what's depositing within artery linings. So hard plaque is definitely more dangerous, because when that hard plaque breaks off, that is what is more likely to cause a cardiovascular event, like a stroke or a heart attack. The other thing that we think of is blood pressure. So like I talked about with exercise, we should get a raise in blood pressure. We want that to happen. We don't want our blood pressure to be elevated all the time. That puts a stressor on the body that is unhealthy. Basically, We're getting more pressure in that arterial system. It's stressed, and we're getting poor oxygenation of tissues. Both large and small vessels are important in this as well. With smoking, we think about free radical damage that is caused by the particles that are being inhaled. We see that as well with vaping, but definitely smoking is still considered more hazardous. The thing that we want to think about too is that when we damage the cells that are within the lungs, there are certain types of cells called alveoli. When those are damaged by long-term smoking, we we are putting stress on that system that is helpful for purifying the blood that goes out to the rest of the tissues and is pumped through the heart. BMI and diet, so body mass index, so weight and diet are kind of two things that go together. If we have a diet that is really high in oxidized things, low in antioxidants, again, we're getting that free radical damage in the body, and we can affect all sorts of things related to our cardiovascular health. Sleep is an important issue. Because while we're sleeping, one thing, the body is healing, wastes are allowing to be cleared, but we're also thinking about oxygenation of tissues. So if we have conditions like any sleep disordered breathing, so that could be sleep apnea, that could be events of hypopnea, so not true apneic events, but still minor events. If we have something called upper airway resistance, so if we have issues with a deviated septum or enlarged tissues in the nasal cavity, we're not getting good oxygenation of the tissues, and that can cause elevated blood pressure. So we kind of split things up into things that we can modify or change and things that we can't. So the things that we can't change, the hand that we're dealt is our sex, our age, and our heredity. So like I was talking about before, especially with patterns of cholesterol, we can inherit what's called familial hypercholesterolemia, where, no matter how hard we try, we have high triglycerides, we have high total cholesterol. That is genetic, that's predetermined, that's not something that we can change. There are different risk factors between males and females, so again, we can't change that. In terms of the things that we can modify, those are all things that naturopathic medicine is wonderful at working on, and Dr. Flanery will talk about those at the end. So we have a lot of risk assessment tools. So Dr. Paul is going to talk about specific labs, but these are just things that we are able to stratify risk. So what that means is that your physician can take those modifiable risk factors. We can discuss them in a visit, and we can use some of these tools that are listed in the upper right-hand corner to calculate somebody's risk. This is helpful to know because it gives someone an idea that either maybe has some markers of earlier cardiovascular disease, maybe they already have metabolic disease, maybe they have had a prior event such as a heart attack or stroke. We're able to put in these modifiable risk factors into a calculator, and we're able to see and calculate based on really good data, what is somebody's chance in the next 10 years of having an event? What is somebody's lifetime risk of having an event? So the one that is the second listed, the CHA2DS2-VASc score, this one is more related to atrial fibrillation, which has a really high stroke rate. Anything that gives the heart an abnormal rate or rhythm is going to give the person a higher risk of having a stroke. The body doesn't know what to do with that and how to regulate that. So we're able to put in those factors for you and assess risk using these tools, and we're happy to do that for you if you're interested in kind of learning these things. They're mostly based on current blood pressure, whether or not you're on medications for blood pressure or lipids, your blood glucose or your blood sugar. So are you pre-diabetes? Are you being treated for diabetes? We do put sex and age into those calculators. And then if you've had history of a prior event, and usually that just means having a heart attack or a stroke. The other thing that we do inherit is our family history. So say, for example, that, it's more important if somebody comes in and they have a parent or a grandparent that died of a heart attack under the age of 50. That's very significant, and that's something that we factor into cardiovascular risk as well. So this is just one of the other risk assessment tools. It's called the ASCVD risk score. So this is the one that I was talking about more specifically, where we can calculate a 10-year risk and a lifetime risk based on the following factors. So when we have these slides available, you can do that for yourself. If you have some of your medical records, you know what your blood pressure is, you've had a cholesterol panel, that type of thing. If you would like us to do that for you as part of a visit, we're totally happy to do that. I do that for my patients when we're treating things like hypertension and lipid levels. So just some general symptoms of poor cardiac function. So things that might let us know that we need to get a screening, we need to get an exam, we need to look at some lab work. Um, and this could be related to a lot of different concerns. So, but more specifically, can usually be associated with cardiovascular concerns. So things like fatigue, feeling tired, low energy. Maybe we're not getting proper oxygenation to our tissues. Maybe we have sleep problems, like I mentioned before. We can get shortness of breath. Is that heart working harder? Is there lung damage? Are there other things we need to take into consideration? Are we having pain in our legs when we walk? Meaning, do we have inflammation of our veins or our arteries in our legs? Are we having chest pain? That can be related to the heart. That can also be musculoskeletal in origin. It's very important to figure that difference out. Are we excessively sweating outside of activity? Do we have edema or swelling in our arms or legs? Are we having an abnormal sensation with our heart? Does it feel like it's beating too fast, beating too slow, beating abnormally? Do we notice palpitations where we feel a heartbeat that we normally don't, or that is new? That's always important to get checked out. Do we feel like we just have poor circulation? Do we notice that our hands or feet are red, purple, or violaceous? Are they always cold? And then one that's also really important and can be related to both cardiovascular and thyroid concerns is, do we have anxiety that is new and it's not really related to stress or our mentality? So I'll just kind of talk through these quickly. I'm not sure what my time looks like. Let me see. So with heart failure, we kind of went over some of those symptoms before, so I won't mention those specifically, but the problem is that we have a low ejection fraction of the heart. So ejection fraction meaning, what is the percentage of the blood that is pumped out of the heart through that left side of the heart to oxygenate the tissues? We want to be between a certain number. If that starts to become low, we think about heart failure. So we're not getting blood to where it needs to go into the periphery of the tissues. Some of the most common causes of this can be hypertension, can be long-term alcohol use, can be structural concerns. There are a lot of different causes of this. In terms of hypertension, this is something that or high blood pressure, we always want to get this worked up because, as I said, there can be multiple causes and many different symptoms. So it wouldn't be pertinent to go over the symptoms because there can be so many different symptoms dependent on what is the cause. So we want to find out the cause. It can be primary or secondary, meaning primary causes are typically renal issues. Arteries become narrowed, that affects blood pressure, or secondary issue. So maybe due to something like poor thyroid control. There is a change in pressure or tone of the arteries due to hormonal signaling, different conditions like I mentioned before, or due to blood volume changes. 3 readings in office qualify for a diagnosis. So 3 readings that are elevated. So typically over 130 systolic or greater than 80 to 85 diastolic. So if you have elevated blood pressure, if that's new, you definitely want to come in so we can understand the cause of that so we can treat more effectively. So with arrhythmia, this is an abnormal heart rate. So it's usually due to electrical or structural causes. So I think a good analogy of this is when we think about using CPR versus a defibrillator, which is, we've all seen that on hospital TV shows. So with a defibrillator, we're shocking that rhythm. We have an abnormal rhythm. We're trying to ignite a normal rhythm through electrical conduction. With CPR, we're simply just trying to pump blood throughout the body when the heart has stopped or someone has gone into cardiac arrest. So when we're thinking about electrical conduction issues, we have two nodes within the heart, SA and AV. So we need that signaling to be clear and concise. If we don't, we get ectopic beats, which are out of place. We could get too fast of a heart rate, too slow, skip beats. And again, the body doesn't like that. It doesn't know how to handle that rhythm, and we have a greater risk for heart attack or stroke. That's why an exam is really important if you feel like your heart rate or rhythm has changed. So Dr. Flanery will talk about vagal stimulation as a way to treat some cardiovascular concerns, but this is kind of the reasoning why. So I love anatomy, so I'll kind of point to this picture on the right here, and you can see that the vagus nerve, it is responsible for innervating so many different structures in the body, but it mainly has to do with innervation of our autonomic nervous system. So that is the paired piece of our nervous system that is the sympathetic nervous system. So that's our fight or flight response. And then the parasympathetic nervous system, which is rest and digest. The vagus nerve is solely responsible for conduction of electricity within the heart. That is all innervated by the vagus nerve. How fast the heart rate is, how slow, how fast our respiration is, our breathing, all of that is done by branches of the same nerve. So if we lack tone within our vagus nerve, then we can start to get things like arrhythmia or dysautonomia, low blood pressure, high blood pressure. So it's really important to keep that tone through parasympathetic activity. And Dr. Flanery will talk about that later. And I will let Dr. Paul take it and talk about some assessment.
Thank you. All right, so we're going to dive into what type of assessment we might do in office, but also in regards to blood work. So in general, our approach is a little bit more detailed and comprehensive than we normally get from your primary care physician. Oftentimes we are ordering more elaborate tests that would give us more information on what your cholesterol looks like, including particle size. And so we'll get to that. So the lab testing definitely is a big piece of how we approach your risk management, because a lot of the testing we do doesn't always correlate to disease, but it correlates to risk. And then hopefully within that risk, there's modifiable risk factors that we can do to improve those numbers and lessen your risk of stroke, heart attack, and so forth. But we always do a thorough physical exam. So when you come in, of course, we're going to check your blood pressure, listen to your heart, feel your pulses, check your vascular system, and check for edema in your legs. That all can give us insight to something deeper going on in the body. Sometimes we also need some imaging. So where physical exam and lab testing don't necessarily diagnose the pathology, imaging can show us a little bit more detail of what's going on the blood vessel level and also the heart. So that can give us a better understanding of, let's say we were concerned about elevated lipids causing atherosclerosis or plaque. It can then tell us how much plaque has been built up in certain arteries, whether that's the coronary arteries around the heart or sometimes the carotid arteries as we do an ultrasound. I'm going to spend most of my time discussing some of the lab testing that we do. And I kind of describe this, majority of the testing is to identify risk. But a key takeaway of labs, of things we're trying to focus on for each individual, is as follows. So the standard lipid panel is becoming somewhat obsolete because we're able to get a more detailed understanding of your lipids, including their size, and we'll get into that in terms of what that means for your body. But in general, oxidation is not your friend. So there's some oxidative markers we look at because oxidation will cause damage to the inner lining of the blood vessels. Then that causes more inflammation and irritation that can lead to additional plaque buildup, which is going to increase your risk of an event. Sugar regulation is definitely important. Dr. Mele touched in on that. We want to maintain the proper sugar levels. One little segue about that, one of the reasons we're interested in triglycerides is when you are eating a lot of sugar, your body actually starts using sugar as fuel instead of using fat as fuel. So some folks might think, oh, I have elevated triglycerides because they eat too much fat. Well, in reality, sometimes it can be to excess sugar and carbohydrate intake because your body starts using that glucose for fuel and not for fat. And so you have more active triglycerides circulating in your body. Of course, a healthy gut is important. There's certain inflammatory metabolites that can enter your bloodstream from your gut that can also damage those blood vessel linings. Genetic testing can be helpful because it provides a greater insight into the best diet and treatment. This is especially helpful if you have like a familial hyperlipidemia, if you're not responsive to treatment. We can do genetic testing, which then tells us if you should be eating a higher fat diet or a lower carbohydrate diet. One other thing in terms of risk factors that's not modifiable is race. So there's been studies where low HDL is not associated with increased risk in cardiovascular disease event in Black adults. So you really have to take into account the person and also the race because some of our risk calculators don't directly translate to people of minority. Also, we need to consider high toxin load if the person is unresponsive to treatment because toxins themselves can damage the blood vessels, leading inflammation, leading to more plaque buildup, and leading to a higher risk of an event. So here's just kind of basic rundown of where I like to start with labs. We're definitely looking at just some basic stuff in terms of complete blood count, complete metabolic panel, looking at kidney and liver function. The standard lipid panel still is useful, but it just provides a limited insight to what's going on. Ferritin can be an inflammatory marker. We see that commonly high in metabolic syndrome, but we also just want to check on iron and iron levels. Hemoglobin A1C, fasting insulin, we're looking at blood glucose levels. Thyroid panel is really important because hypothyroidism can make you more likely to or contribute to higher cholesterol levels. HSCRP is kind of a specific cardiovascular inflammatory marker. And homocysteine also is a bit of an inflammation toxin marker, which can suggest there's greater oxidative damage or risk to the body. The expanded profile might include the NMR lipo profile, which this starts looking at particle size. So we've kind of identified HDL, LDL, triglycerides, and total cholesterol. Well, we can then break it down even further where what do those LDL particle sizes look like? And I'll explain why we actually want larger particle size than smaller ones. We can also look at lipoprotein electrophoresis. This is where we get a better sense of what the lipoproteins look like. Oxidized LDL, we've already been talking about we're trying to avoid oxidation. We don't want to see that oxidized LDL in the body. And then other things in terms of apolipoprotein A1, apolipoprotein B, those affect HDL and LDL in ways that impairs their ability in the body. Omega check can be a look at your omega-3/6 balance because typically we like higher omega-3s. They're more inflammatory. Lipoprotein insulin resistance score gives further information about our insulin resistance in the body. And ApoE is also related to how cardiovascular disease risk can translate to conditions like Alzheimer's and dementia. So I did mention the NMR lipo profile. So you can see here in this diagram where the lower risk individual, Jerry, is at a lower risk because his LDL particles are of larger size. So you can think about this as you have your blood vessel and, cholesterol is moving, imagine it's a round sphere. It's more likely to clump together if it's small. So we actually like a little bit larger lipoprotein particle size, because that allows them to travel through the blood vessel much easier. So yes, we're interested in the number of cars going through that passageway, but we're also interested in the size. You know, we don't want a bunch of semis clogging the highway, basically. A lot of people come to me and they're like, oh, I got good cholesterol. It looks, you know, at this level and I bad cholesterol LDL. Well, why actually is HDL considered more healthy? Well, the main reason it acts kind of as an antioxidant. So it can help trade triglycerides with cholesterol esters. So basically, it can kind of exchange parts of cholesterol to make them less oxidative, to create less stress on the body. So it's taking this cholesterol from our foam cells, which these are involved with plaque formation. And by taking cholesterol from the foam cells, it calms them down and would then prevent plaque formation. It also supports nitric oxide production, so that's helpful for the vasodilating and restriction of our blood vessels. It's considered anti-inflammatory. It helps clean up those oxidated LDL cholesterol floating around in the body, and it can uptake bad fats from peripheral cells. Some additional tests that can provide some very valuable insight are some of our additional inflammation markers. So, such as myeloperoxidase, that is an enzyme that can add additional oxidative stress to the system. PLAC is also pro-inflammatory. TMAO also would increase your risk of an event. This is higher when you have a lot of dysbiosis in the gut. These metabolites get into the bloodstream, contribute to a higher risk. Genetic testing can be very helpful, as I mentioned, determining what might be the best diet based on your type of hyperlipidemia. Glutathione is important because glutathione is our major antioxidant in the body. You want to make sure you have high glutathione levels. And then if somebody isn't responding to our typical treatment plan, whether managing lipids or reducing blood vessel inflammation, you really want to think about what you're being exposed to in your environment. So certain heavy metals, mold mycotoxins, glyphosate, and other chemicals can add additional toxin oxidative stress to the body that will then contribute to that cardiovascular disease risk. Here is a table of the different phenotypes of several hyperlipidemia types. So type 4 is actually the most common. And if you were tested positive based on your blood work for this one, it's actually best for you to avoid carbohydrates in your effort to bring down your cholesterol levels. If you were type 2, a low-fat diet is actually better for you. So this is where the genetic testing can provide that missing piece as to why you might not be responding to your treatment plan and how to identify the right diet for you. All right, I'll let Dr. Flanery take from here. Thank you.
All right. Hello, everyone. Just make sure my mic's on. Can you all hear me? Yeah?
We
Okay.
do.
All right, so I'm going to be reviewing some natural approaches to treating cardiovascular prevention as well as disease. I do want to say that the focus will be on natural approaches, but we do utilize pharmaceutical interventions when indicated. And just because the things that we're talking about next are natural, you should still consult with a doctor and make sure that all these things are safe for you. Let me reduce that. All right, so we kind of talked about with Dr. Despres diet. It's really going to depend on the person. In general, I like to focus on whole foods with patients. The one diet that's probably been studied the most is the Mediterranean diet. But in general, we want to get a lot of fresh fruits, vegetables, whole grains, legumes, nuts, seeds, olive oil, and fish. So a big emphasis on antioxidants and omega fatty acids. We want to look for lean meats that are not processed and complex carbohydrates. Complex carbohydrates, they are things like quinoa, squash, yams, beans. And essentially what they do is they digest slower, so you're not going to have as much of a blood sugar spike. I like to focus on balanced meals with people, and this goes back into blood sugar regulation. And what a balanced meal looks like is that you're pairing your carbohydrates with a protein, a healthy fat, and then some fiber. And essentially, when we're pairing them with these foods, the carbohydrates, we're not going to see as much of a blood a blood sugar spike. So herbs, we can utilize these in tinctures and other ways, maybe some supplements, but I like to incorporate them into the diet. They offer a lot of anti-inflammatory benefits. Ginger and cinnamon also help with blood sugar regulation, and turmeric and garlic can also help with cholesterol. In general, we want to focus on limiting the amount of sugar that we're consuming, as well as processed foods. Processed foods contain a lot of added sugar, as well as sodium and fats. And then making sure we're not overdoing refined carbohydrates. So these are things like breads, pastas, baked goods, and then sea and vegetable oils. They have a known, they're very oxidative stress or inflammatory. And then caffeine. So we want to reduce the amount of caffeine that we're having. What it will do is it will constrict the blood vessels. So if you have any palpitations, arrhythmia, hypertension, it's going to aggravate this. And then alcohol has excess sugar. It's going to have some damage to the liver. So it's not going to be good for our metabolic syndrome. Okay, so moving into lifestyle, Dr. Mele covered why exercise is really important. The general recommendation is about 150 minutes per week, and you can split this up however is best for you, whether it's 30 minutes 5 times a week, or maybe you want to split that 30 minutes up throughout the day. It's best to get a little bit of aerobic and resistance training on board. I'm a big proponent of gentle movement after meals. So I do mean gentle, not rigorous. And essentially what this is going to do is when we're contracting and moving the muscles in a way that's going to pull the sugar out of the bloodstream, and that's going to decrease spikes in blood sugar. We talked about smoking as a big risk factor. So we want to make sure we're supporting patients with coming off of smoking. We can use herbs and supplements to help support neurotransmitters and kind of help with cravings. And then there's also something called NADA, which is an acupuncture protocol that's meant for addiction. So we talked about sleep. So 7 to 9 hours, that's going to be something that we want to aim for. A lot of times people don't have good sleep because they're not setting themselves up for good conditions of sleep. And a lot of times that means decreasing blue light exposures at least an hour before bed, making sure that the room is cool and that we don't have a lot of light source. So whether that's blackout blinds or an eye mask. And if you find yourself sleeping a lot and you wake up and you're still fatigued and you know you snore, this might be a good time to check in with a sleep study and make sure that you don't have any sleep apnea. Stress management. I think we can all use a little bit of stress management, but this is really important for cardiovascular health and honestly overall health in general. I find that this depends on the patient because we really want to make sure that this is a long-term thing that someone can implement into their life. So I like to go over different ways and strategies since this looks different for everyone. So this could be anything from meditation. It may be doing yoga, deep breathing. Maybe it's just going for a walk or spending some time with your loved ones. So we learned about the vagus nerve and how that's going to impact the heart. So there's ways that we can actually stimulate that nerve. And one way that we can do is through cold water exposure or cold exposure in general. We can do gargling, singing, deep diaphragmatic breathing. So that can all help stimulate that vagus nerve, especially if you're having arrhythmias or hypertension. And then infrared sauna, this has been shown to help with blood pressure, but it also helps us eliminate some of the toxins, especially some toxins that Dr. Despres had mentioned. Okay, so supplements. This is just some common conditions that we might treat directly related to cardiovascular health. This is not extensive. So if you have thyroid issues or other things, we really want to pair the proper supplements for you. But in general, antioxidant support is going to be very important. We talked a lot about oxidative stress and how that impacts blood vessels and increases the risk of having plaques in the arteries. So things like CoQ10, anthocyanins, which is derived from berries, bioflavonoids, which are found in plants, and then vitamin E, A, and C. Hypertension. So magnesium has been shown to help with hypertension. It's definitely a lot more of a mild treatment, but it can be helpful for some people. Magnesium taurate has been a little bit more studied directly related to cardiovascular health. Potassium definitely has some help with hypertension, but I find that most people get enough potassium in their diet. So this is definitely something that we don't want to get too much of. So we definitely want to check in and make sure that we don't have kidney disease or anything else that might make potassium supplementing dangerous for people. So just be careful with that, but know that that's a potential treatment for hypertension. Then moving into cholesterol, we do have a lot of different variations in what we're targeting for cholesterol. The first thing I have listed here is fish oil. This is actually meant to help raise your HDL or your protective cholesterol. It doesn't have as much effect on lowering other cholesterol, but it will impact your HDL and help that get to a better level. Red yeast rice, plant sterols, these are all going to help lower LDL levels. And then niacin has a little bit more of a target on the triglycerides or that fat floating around in the bloodstream. And then clotting, so these two things listed below, nattokinase and ratiopeptidase, these are what we call proteolytic enzymes. They're going to help break down proteins in the blood, specifically proteins that are involved in inflammation pathways. So this can help with plaque formation along the arteries and decrease the risk of clotting. So they kind of act as like a blood thinner. Okay, the last thing I have is botanicals. I've used a lot of botanicals in my practice, and so do Dr. Despres and Dr. Mele. We get really great results with cardiovascular disease by utilizing them. There's a lot of things listed here, as you can see. I'm not going to go through each herb individually, but I think I want to make just a point that when these things are used in combination, because a lot of times people will have hypertension and cholesterol, or maybe thyroid concerns. What we can do in our office is we can take herbs that match the patient's constitution and the conditions we're trying to treat, and we can combine them all into one formulation so it's targeted and specific for that person. Again, just like anything else we listed, you want to make sure that we're not just grabbing these things and trying them out. You really should consult with a doctor before starting any of these. Okay. Thank you all for attending. If you have any questions, feel free to unmute yourself and ask. I don't think I see anything in the chat. Nope. Okay.
And I don't believe they can say anything, but you can type something in the Q&A or the chat if you have any questions for us. And if not, we have a few questions we will facilitate a little discussion for you. So let's just give it a few seconds, see if you have any questions. And I guess maybe while we wait, maybe you'll think of questions. I have one for Dr. Mele. So, and also probably for you, Dr. Flanery, you guys use a lot of botanical medicines. How well do you find they complement people who are on medications? Do you find, it's a replacement or they work together? What's the usual like progression you have with those folks?
So usually I find that they work very well together and even complement. I am comfortable with using herbs with patients that are on really common medications like statins or ACE inhibitors or beta blockers. If we're using things that are cardiovascular tonics, those have really good research to support that they do not interfere with ACE inhibitors or beta blockers. If we are using low dose herbs to manage more of a rhythm issue, so things like atrial fibrillation, palpitations, things like any type of arrhythmia, then we really want to be cautious with using those botanicals with medications because they're both affecting rate. So I tend to have more caution if I'm using low dose botanicals for rate rhythm control. Otherwise, they integrate very well.
And then I guess a question for you, Dr. Flanery, how often have you used acupuncture for hypertension? Have you seen any results with acupuncture?
Yeah, I have seen some results. It kind of depends still on the cause for the hypertension in the first place. But I definitely see that lots of people that have stress involved in that picture can be really helpful. Sometimes even when it's not related to stress and it's high in office, we can get the levels down while we have needles in. But then sometimes when they leave, that we can see a rise in that blood pressure. So it's definitely not a replacement for having medication. But I have seen it help.
Great.
Wanted to add something too that, even if you are currently on medications, we're always happy to see, is there a medication that you might tolerate better? Can we start to titrate that medication down once you're doing better with natural accompaniments? So I do that a lot for patients where they come in, they're not tolerating a medication to lower their blood pressure, and we find something that's more comfortable for them, still works just as well, but they have fewer side effects. So that's something that we're also happy to do.
Yeah, I've had several people come in who have been on statins for elevated cholesterol levels. We do a lot of diet, supplemental interventions, and slowly we're able to taper them down and taper them off their statin. And statins we try to avoid. I mean, I think it's fairly well known they contribute to a lot of muscle aches. They suppress mitochondrial function. That's further adding to, I think, a lot of issues with long COVID. People are on chronic statins related to that. And then the same goes, like Dr. Mele said, for a lot of blood pressure supports. At first we might layer stuff on top of the medication and see how stable they are. They'll take their blood pressure at home. They'll come into the office. We'll check it. But eventually we're able to get their medications either reduced or get them off of that. So.
And to piggyback onto the medications too, there are a lot of depletions with certain medications that people are on. So we can kind of optimize that and make sure that we're having less side effects from medications that you are taking.
Mm-hmm.